Hello, I'm Dr. Brandt Gibson. Tonight I want to talk to you about fractures again. So we talked about forefoot fractures. We're now going to talk about rear foot fractures. These are fractures on into the metatarsals and to the tarsal bones. And this can be a big deal. A lot of times with these types of fractures, you're going to have a lot bigger injury, a lot bigger problem. And again, there are three different types. You can have a stress fracture, you can have a through and through type fracture, and you can have a, what would you call it? I guess you could call it a displaced fracture, right? Is what we're saying. So in these particular things, it's a bigger deal. And truthfully, whether it's a metatarsal fracture or it's a cuneiform fracture or it's a cuboid fracture or a talus or calcaneus fracture, they're all treated very similarly, although they need to be evaluated differently depending on what's going on. So I'm going to be very general on purpose. And the idea here is, sorry, I have the hiccups a little bit, but the idea here is that with a fracture in the midfoot and rear foot area, these are bigger deals. They need to be protected a lot more. You're not going to tape them as you would forefoot fracture like the digits. You're going to actually need to do something a little bit more. That may include everything from casting to putting in a boot to putting on crutches where you say, okay, you can't walk in this on all, or a knee scooter, that kind of a thing, because the situation is, it's a lot bigger deal, a lot bigger fracture, a lot more potential for long-term problems, a lot more potential for disability and so forth. So we need to be a lot more careful in protecting these fractures. We're also quicker to go back to surgery on these to say, okay, we got to go in and fix these because they're going to be a lot more unstable because they take more of the weight of the body. So if you have a metatarsal fracture that's through and through, a lot of times even if it's not displaced, we may fixate this with screws and pins and so forth. If it is displaced, we will always fix them because, assuming the person can actually do surgery, I guess I should say, but in 99% of the time, we're going to go in and fix those if they're displaced, because you get long-term disability, long-term problems if it's not fixed, especially if it's not done in a good manner. So that's something to think about. As soon as you get to the talus and calcaneus, the difficulty and the need for surgery even goes up more aggressively because of those situations. So what are you going to think about? What type of fracture is it? Is it a stress fracture, a non-displaced fracture, or a displaced fracture? What are you going to do initially? You're going to do the same thing: rest, ice, compression, elevation. But a lot of times you're going to look at it and say, okay, does it need to be further immobilized? Does it need to be fixated in any way? Does it need to be surgically corrected? So the best thing you can do if you injured the midfoot and rear foot is to get evaluated and get x-ray, get it visualized and determined if additional things need to be done, and go to a surgeon that actually does these on a regular basis. The idea is you don't want to go somewhere where they say, yeah, I do bone repairs all the time. You want to make sure it's someone that actually treats those type of fractures. Calcaneal fracture, you want someone that does calcaneal fractures on a regular basis. So this is Dr. Brandt Gibson, and this is your Podiatry Tips Day 365, fractures of the midfoot and rear foot. And remember, you want to immobilize these, you want to get an x-ray, you want to determine if you need to go surgery and how quickly they need to go to surgery, and then get it done in a correct manner. And if you would like additional information, or if you want help figuring out what else to do with these, you can go to utahfootdoc.com and I can give you some help. And the truth is, if you have fractured that area of your foot, you need to be evaluated by somebody that sees these on a regular basis. I don't recommend emergency room. I don't recommend Instacares. I recommend you go to a